From the obvious cases such as anxiety and stress relief, to managing procedural pain, treating cancer pain, and even addressing skin conditions like eczema and psoriasis, hypnotherapy offers solutions for a wide range of issues. Join us as we explore the fascinating world of hypnotherapy and its incredible benefits. Who knows, you might just add hypnosis to your skincare routine. Hi, I'm Dr. Uda. Today, we're talking about the wide variety of issues that hypnotherapy can be used to address. The medical articles I referenced in this video will be timestamped in the description below for you. Research shows that hypnosis has a top-down effect on the body rather than just a neurologic post-processing of sensations, meaning that while in hypnotic trance, and for many cases far after, specific nervous potentials can be selectively increased or reduced and certain signals enhanced. For example, in the case of lower back pain, a top-down approach means that the brain can selectively reduce the sensory input coming from the neurons that innervate the lower back, effectively turning the volume down or putting them on mute entirely. This is in contrast to a more stoic, neurologic post-processing approach where the brain would simply have to ignore the pain signals presented to it from these lower back sensory neurons. However, not only can hypnotherapy directly affect the functioning of sensory neurons, but it can very powerfully affect the autonomic nervous system, which is part of the peripheral nervous system that contains the sympathetic nervous system, and the parasympathetic nervous system, also known as the fight, flight, or freeze system for the sympathetic, and the rest and digest nervous system for the parasympathetic, respectively. I know, a lot of different systems, but just bear with me. The autonomic nervous system regulates blood pressure, heart rate, respiration, salivation, digestion, inflammatory response, the release of certain hormones, and of course, our favorite, arousal. Speaking of arousal, awesome segue, I know. There have been many case studies over the years on the effectiveness of hypnotherapy and psychogenic ED, or erectile dysfunction, which is ED without an obvious organic cause such as vascular disease. Psychogenic ED makes up around 20 to 40% of ED cases. Hypnotherapy has been found to be very effective in overcoming psychogenic ED by allowing those suffering from it to analyze counterproductive subconscious and unconscious behaviors and beliefs, disarming them, and then installing new productive ones through root cause hypnotherapy, or via the use of visualization to prompt relaxation and promote stronger erections. Hypnotherapy has also been found to be effective for dyspareunia, which is persistently painful relations, vaginismus, or painful muscle spasms of the pelvic floor, and endometriosis, which is a painful disorder where uterine tissue grows outside of the uterus, causing inflammation, pain, and at times fertility issues. These conditions can be caused by poor natural lubrication, at times from poor blood flow, chronic inflammation, increased muscle tone, irregular hormone regulation, and gut or pelvic organ dysmotility, all of which can be countered by the parasympathetic nervous system, and more specifically, the pelvic splanchnic nerve, which you can think of as the cousin of the ever-popular vagus nerve. Put simply, the vagus controls the parasympathetic, again, the rest and digest, innervation above the waist, and the pelvic splanchnic nerves control the parasympathetic innervation below the waist, meaning urination, arousal, genital blood flow, and digestion in part. Unfortunately, there have not, to my knowledge, been larger trials looking at the effects of hypnotherapy on blood flow through the pudendal or genital arteries. However, we do know that the activation of the parasympathetic pelvic splanchnic nerves controls arousal through the release of vasorelaxants. These are signalers that lead to the dilation of arteries and vessels, and we know that hypnosis can activate the parasympathetic nervous system. Despite this hole in the research, there have been small studies looking at the effect of hypnosis on the blood flow of various extremities with positive and statistically significant findings. Sickle cell disease often causes severe episodic pain crises that are challenging to manage, but hypnotherapy has shown promising results in the aid of managing these symptoms on top of standard of care medications. A 2-year study on self-hypnosis training for sickle cell pain management found significant reduction in the number of pain days among participants. This indicates that hypnotherapy can be effective adjunctive, meaning additive, treatment for managing sickle cell pain. Research indicates that hypnotherapy can significantly reduce the pain and stiffness associated with osteoarthritis. Participants in the study reported lower pain levels and reduced need for their standard of care analgesic medications after undergoing hypnosis sessions. Fibromyalgia, which is known for widespread pain and fatigue, is another syndrome that can be addressed with hypnotherapy. In a controlled trial, participants who received hypnotherapy reported significant improvements in muscle pain, fatigue, distress, and sleep disturbances associated with fibromyalgia compared to those who received physical therapy alone. In a study involving women with chronic breast cancer-related pain, those who received hypnotherapy reported significantly less pain compared to those who did not. Another study with advanced stage cancer patients showed that hypnotherapy led to a significant overall decrease in pain. IBS can also benefit from hypnotherapy, which makes sense when the effect of the parasympathetic nervous system, or the rest and digest system, is considered. Furthermore, many skin conditions are triggered or worsened by our body's stress responses, which is what is directly addressed by hypnotherapy. The powerful visualizations elicited during trance states of hypnotherapy can greatly improve athletic performance during competition. In fact, many world-class athletes and fighters utilize hypnotic trance and active visualization in their regimen. Hypnotherapy can also be used to enhance academic performance by improving memory and recall, as well as artistic performance by augmenting creativity both during and after hypnotherapy sessions. On top of performance, hypnotherapy can also be used to address low self-esteem, stress management, and confidence by exposing and eliminating schema or beliefs that detract from our well-being, and is also useful for improving communication, emotional connection, stress management, grief, and helping to develop effective coping strategies to painful situations. Hypnotherapy is also fantastic for addressing behavioral issues. It can help break unwanted habits and can alter the subconscious associations and cues connected with addictive behaviors, making it easier to overcome challenging issues from nail biting, smoking, gambling, and even sexual addiction. And finally, hypnotherapy is effective as adjunctive therapy on top of standard of care for the management of phobias, post-traumatic stress disorder or PTSD, general anxiety disorder, depression, and insomnia through a combination of root cause approach and visualization approach. So as you can see, hypnotherapy offers a multitude of benefits for varied conditions. If you know anyone suffering from any of these conditions, then please share this video with them so that they can find a specialized hypnotherapist in their area. If you are interested in going deeper into the research, then don't forget to check out the links in the description below. In the next video in this series, we are going to talk about what neuroplasticity actually is and how hypnotherapy influences it.